I'm Sharmila, physiotherapist, working as a clinical instructor in Sri Indira Ganeshan Institute of Medical Science, College of Physiotherapy. My topic is about elbow joint, which is one of the important joint present in upper limb of the human body. Now let's see the anatomy of the elbow joint. So the elbow joint is a type of a synovial joint which has three articulations, namely the humerus and ulnar, humerus and radius, and the radius and ulnar. First, the humerus and the radius is a uniaxial hinge joint permits extension and flexion. The second is the humerus and radius, which articulates with the head of proximal radius. The third is the radius and ulna, which permits supination and pronation. There are two types of ligaments, namely the medial aspect and the lateral aspect. So the medial ligament is otherwise called as ulnar collateral ligament, which consists of three components. The anterior band is attached to the coronoid process of ulna, and the posterior band is attached to the medial border of the olecranon process. So the third is the middle band, which connects both the anterior band and the posterior band. The lateral aspect is otherwise called as radial collateral ligament, which consists of two, namely the capsule and the annular ligament. So the annular ligament is attached to the margin of the radial notch on the ulna and surrounds the head and neck of the radius. The blood supply of the elbow joint is radial artery, ulnar artery, and the brachial artery. The nerve supply of the elbow joint is median nerve, musculocutaneous nerve, ulnar and radial nerve of brachial plexus. So the tendons is two types, biceps tendons and the triceps tendon. So the movements of elbow joint are flexion, extension, pronation, and supination. So the pronation is inward rotatory movement of radius on ulna, and the supination, which is nothing but the external rotatory movement of radius on ulna. The muscles are namely the elbow flexors, extensors, pronators, and the supinators. The most important thing is the carrying angle, which forms the axis of humerus and longitudinal axis of forearm. So the abnormality is increase in carrying angle results in cubitus valgus, decrease in carrying angle leads to cubitus varus. Three clinical anatomy, namely the golfer's elbow, which is otherwise called medial epicondylitis, which results in inflammation on the medial side of the elbow. The second is the lateral epicondylitis or the tennis elbow, which results in inflammation or pain in the radial side of the elbow caused due to repetitive stress. Third is the nursemaid's elbow, which is otherwise called pulled elbow. It results in subluxation of head of the radius with the annular ligament while lifting the chair. Thank you.